Niall Dickson, are you there? Chief Executive of the NHS Confederation.
I am here.
You are. Lovely to speak to you, sir. Thank you very much indeed for joining us. Let's just talk about some of the the good news today. The rollout of this 10 million antibody tests from next week to NHS staff and carers. Antigen tests that could take just 20 minutes after a swab. They're being trialled on NHS staff over the next week. New infections have fallen 40% in the past 2 weeks. It looks like almost 4 million across England, largely in London, have had the virus. Does this all fill your heart with some optimism that we are on our way out of this pandemic, or are you still wary of a second spike?
Well, both. Of course, we're very pleased, and the antibody test has been held up for a long time as a possible game changer, and I think it is just a possible game changer. It's exciting for two reasons. The first is that it will allow better surveillance and understanding who has the virus, including where they live, their age, their underlying conditions, all that is going to be very helpful as we move on to the test, track and trace approach. Secondly, of course, and I think many of your listeners will know this, if you have the antibodies, unfortunately it doesn't mean that you're immune. We don't know. It may mean you're immune or it may not, and it just shows how the scientists really are trying to understand this virus. Some viruses the body absolutely remembers, and if you've had it once, they fight furiously and you don't get it. You can't get it again, at least for a year or 2 years. We just don't know that about this virus yet. If it does, if immunity means that you can't get it, that's a game changer, and that's, they're talking about the idea of certification or whatever else, and very important for staff, obviously, working with COVID patients, and indeed, as I say, for the wider public. On the antigen thing, I do think that is important. If we can get results quickly back, of course, that again reduces risk, doesn't it? Because as soon as 20 minutes later, you know whether that person has got the virus. This is the antigen test, and that is really good news. And today, some of the care providers were saying, let's get this into homes, and so that people are repeat testing. You've always got to be aware that people without symptoms don't always show up positive, but if you can catch more of them at an earlier stage when they're asymptomatic, again, I think that really will help to suppress the virus. So really pleased about both of those. And your other point is that what's happening in London, I think, is really good. It's clear quite a lot of people have had the virus. It may even be more, because I can certainly think of people I know who've got the virus, who've had the virus, and they've never told
most of my family's had the virus, but of course we can't. We're 99% sure, but until we have an antibody test, we can't know for certain.
Exactly, and I think understanding that is going to be so important in how the virus spreads and so forth. So I'm very optimistic in that sense. But elsewhere, and you look at other countries, and they seem to have avoided, most of them, not all, but, a kind of second spike. So I think, there is cause for optimism, but there's also cause for caution, and getting the test, track and trace thing properly in place so that it is effective, so we can dive down on outbreaks wherever they occur and understand where they're occurring. That's going to be really important.
That's going to be absolutely vital, isn't it? Now, you and I have been speaking throughout this pandemic and about the practicalities of making sure we minimise the number of people infected, minimise the number of people who die, and that our health service and care system can actually cope. And you represent organisations across the healthcare sector, and you said earlier this week that care homes are where the major battle with coronavirus is raging, and they were being neglected for too long. And you also urged the government to have a clear strategy for getting us out of the lockdown, whether it comes to schools returning, businesses returning, but a clear implementation of a plan ahead of actually coming out of lockdown properly. Are you confident that is now in place?
Not quite, I think, is the answer. And I accept, somebody said this is, a bit like trying to repair the aircraft at 33,000 feet. So I have a lot of sympathy for people at the centre and how they're managing this process, not wanting to raise people's expectations, not necessarily say this will happen then and that this will happen at the next phase. But I think some greater clarity will be helpful, and there are phases which the government has already identified and so forth. I think our anxiety was that if we went not the steps they've already taken, which again, one assumes that on the best scientific advice that they have at the moment is the right thing, but that we don't rush further into further relaxation until we've got the test, track and trace in place. And there are clearly hiccups in that. That's not been easy to do. Arguably, it could have been done earlier, and we could have got some of this in place earlier. And there were two elements that obviously are currently raising concern. One is the app on which the government appeared, anyway, to put a huge degree of reliance on. That is we're still working with that, and it's not perfect, and it's not, I don't think, ready to go at the moment. It may be, but again, big question mark over that. And the second thing is the issue we've been going on about for some time, which is you can't simply rely on a national system with national call centres and people phoning up and all the rest of it. You have to have boots on the ground. You have to involve local contact tracing teams who will visit factories or somewhere where there has been an outbreak, and who can actually do old-fashioned contact tracing as well, and also involve GPs and others in supporting the most vulnerable who may be affected by this, and who, for example, might find it very difficult on their own to isolate because there's somebody else in their family. So we need to have local involvement in the national system, and you need to mobilize the local army as well as doing all the national stuff. And again, until very recently, I think we had real concerns that the local people, like the directors of public health, had not been properly involved in this. I'm more optimistic now, but again, the time isn't great. We need to set all this stuff up, and we need to get that right.
Absolutely. I think everyone will agree with you on that. Niall Dickson, always lovely to speak to you, Chief Executive of the NHS Confederation. Thank you very much indeed.